Where does microneedling fit in? There's a lot of good early evidence for that. Where do you see that fits in?
I love talking about microneedling because it seems so great. Like you just do it at home and you're good, right?
Right.
The problem that microneedling has a huge variety of definitions, right? So when people say, "Hey doc, do you recommend microneedling?" I said, "Well, yeah, I use microneedling like every time we do a standalone PR." The device that I use in the operation room, literally in the procedure room, is very different than that derma roller that you bought from China on Amazon.
Okay.
It is not the same. It
Well,
is
some of
not a
them are
Dr.
not
Pen.
rollers. Some the
A Dr.
pens.
Pen. Yeah.
Yeah.
A Dr. Pen that you're running across your scalp at God knows what kind of speed or sterility that thing is providing. It's a very different device. A Dr. Pen is probably like maybe $100, right? On Amazon.
Right. Yeah.
The devices that we use in the operatory, it's a $10,000, like finely tuned German microneedling tool. It's like the exact opposite. It's like a difference between a go-kart and a race car. They couldn't be farther away on the spectrum of therapy. And so probably the disposable that we use, which is the little tip that's hermetically sealed and different separated from the tool end of it, right? That little disposable tip is so sophisticated. That little tip probably costs almost as much as a Dr. Pen.
Mhm.
That would be like using a Dr. Pen and then throwing it away every time.
Okay.
Do you understand? So there's a huge difference. So what would be the purpose of microneedling? There's a few things that microneedling can do for you. Number one, you're making, if you do it, let's say gently, little tiny punctures in the scalp, that would be good for enhancing the penetration of treatments. So treatments could be peptides, copper peptide, thymosin beta 4 derivatives, VEGF. These are peptide treatments that you can apply to the scalp, right? And growth factors. You're also going to enhance the penetration of minoxidil and finasteride or dutasteride, whatever you're applying up there. It sounds really good because you're bypassing the stratum corneum, which is that moisture barrier. You're making a little hole in it, essentially, maybe even a lot of little holes, and you're getting a very deep dive, if you will, in terms of those growth factors and serums or medications and pharmaceuticals. So that's great. If you're doing it with a procedure like platelet-rich plasma, the purpose of the microneedling as a finishing step is not to get something in through the skin, but actually to trigger a little bit of microtrauma. And I think that most of us biohackers understand that a little bit of hormesis, hormetic stress, if you will, has a powerful effect in many areas of the body, and the skin is one of them. If you create a little bit of micro wounding, I'm not talking about like you're trying to resurface your scalp with that Dr. Pen. I'm talking about a little bit of triggering of blood flow and a little bit of wounding that's microscopic. You can actually create a surge of growth factors endogenously in the body, which can then stimulate hair regrowth. And so that's a really nice effect. So those are all the beautiful things that you can do with the microneedling as a tool and treatment in the office. And if you're doing it carefully at home, you could get a similar response. But what I found is that people are still using the same derma roller or the same derma pen that they bought a year ago. And I just know that it's almost impossible to clean those sterilely.
Very
How deep
difficult.
they're going, how deep
Yeah.
they're going into the scalp varies immensely. And everybody's scalp is a little bit different. If you've been on, let's say you're a 50-year-old guy and you've been on testosterone, your skin might be thicker. But if you're a 50-year-old woman, your skin might be thinner. And so you have to titrate and adjust the microneedling tool to the collagen layer of the skin and also what you're trying to do, what the effect is. I think a lot of people can get into trouble with microneedling because they're so readily available now. You can buy the cartridges, you can buy the Dr. Pen, you can buy the derma rollers. We prescribe and dispense a microneedling kit. It's called the Preppy Suite, and it's gold plated, so it's easier to sterilize. It creates less tissue reaction at the level of the skin. It's very different than the titanium needles, which are very rough that you would typically see. But we prescribe very sparingly and with a huge amount of instruction. Don't screw this up because think
Right.
about this, if you create too much trauma and too much inflammation at the level of the scalp, what do you think is going to happen to those hair follicles?
Not they're
What's
not gonna grow
You're going
very
to
well.
replace those. Not only are they not going to grow, but you're going to end up replacing those follicles with scar tissue. And if you do that, guess what? You need a hair transplant.
Okay. What about
That's not a good plan.
scalp massaging or combing? That's something I've seen online that some people get really good results by basically massaging their scalp, trying to make it as flexible as possible. And that seems to have a very good effect on hair regrowth.
So, yeah, what's interesting is that even today, and of course, it was like almost like a wives' tale, right? That, oh, you just massage your scalp and your hair will grow better. And so I'm not convinced that's going to be a miracle cure for people. But here's the thing, there are some scientific studies that show that the signal, remember we talked about cells, signals, and scaffolds as regenerative medicine technology, the stretching of the skin is actually a mechanical signal. And there are studies that show that mechanical signals like stretching, they do impact hair follicle function. So it's not so much an old wives' tale anymore. I just don't think that's going to be a miracle cure for the vast majority of folks. We do offer scalp treatments, therapeutic scalp treatments in the office. In fact, I have an entire department that's geared around my certified trichologist and hair coach, Kimberly. She's amazing because there's so much inflammation and dysregulation at the level of the scalp from the different shampoos and toxins that are out there and lifestyle factors. And sometimes we need to actually apply a therapeutic regimen using a scalp massage and a scalp treatment. And I will tell you, there is no better stress release than a 60 or 90-minute scalp treatment in my office at Bauman Medical. It is at the very least, you're going to be in la land after 90 minutes of scalp treatment. Hands down, no question. You will not be able to, you're going to be like Joe Biden in the debate. You're not going to be able to speak after that.
I love the scalp treatments.